NEET PG uh, paper solution. A very tall man presents with visual problems and is found to have ectopic lentis on ophthalmological evaluation. Which gene is most likely defective in this patient? That would be your fibrillin 1 gene on chromosome 15. Fibrillin 1. A 30-year-old man presents with a painless testicular mass. An ultrasound shows a well circumscribed, homogeneous, non hemorrhagic testicular tumor. Which of the following is the most likely diagnosis? It is seminomas with your Freydag appearance and lymphocytes. A patient presents with hearing loss and balance problem. Histopath shows Verrucay bodies, antennae A and B. What is the most likely diagnosis? Schwannoma in neurofibromatous 2. A child presents with visual disturbances and delayed growth. Imaging reveals a suprasellar mass, and histopath shows the presence of wet keratin, compact eosinophilic anucleate keratin. What is the most likely diagnosis? Because the word mentioned wet keratin, it has to be craniopharyngioma. Which of the following lab techniques is most commonly used to compare and quantify CD markers on cell? That is your flow cytometry. A patient presents with a mass in front of the neck, along with odynophagia and dyspnea. Histopath reveals tumor cells positive for ETF, synaptophysin, chromogranin. And there is also amyloid deposition. What is the most likely diagnosis? Because ACAL, amyloid, deposits in medullary thyroid carcinoma. That is your answer. A patient presents with knee joint swelling, synovial fluid, have positive bisfringence, rhomboid-shaped nucleus. That is your pseudo gout. This type of epithelium, your umbrella cells, is seen where? That would be your ureter and urinary bladder. A patient presents with intensely itchy vesicular lesions on extensor surface, history of gluten sensitivity. A skin biopsy with immunofluorescence shows the following pattern, that is linear. IgA was mentioned in the question as well. What is the diagnosis? It is dermatitis herpetiformis. There was a one-liner for anti-mitochondrial antibody positivity. The answer is um, BPC. It was actually a case, and the patient had pruritus, they had jaundice, then their calcium was 8, they had ANA was absent, but anti-mitochondrial antibody was present, and you had to differentiate between sarcoidosis and PBC and autoimmune hepatitis. So the answer here, because there's presence of anti-mitochondrial antibody, is PBC. A patient presents with 1 month history of cough, chest pain, and dyspnea. Imaging reveals a apical lymphadenopathy, and biopsy shows granuloma formation. Which of the following is the most likely diagnosis? It would be sarcoidosis. There was a picture where you can see dural tail sign, and that is meningioma. So that is your answer. A middle-aged woman presents with dry eyes, dry mouth. Laboratory test reveals positive anti-Ro, anti-Ra. What is the most likely diagnosis uh, of, and pathological mechanism? So diagnosis is your Sjogren syndrome, and pathological mechanism is lymphocytic infiltration and destruction of salivary glands and lacrimal glands. A patient presents with frothy sputum, hemoptysis, dyspnea, paroxysmal nocturnal dyspnea. The biopsy of the lung shows hemosiderin-laden macrophages, and you had to tell all except where you do not see this condition. And the answer is protein losing enteropathy. That was in the option. All the other volume overload, RV failure, and pulmonary vein constriction, you will have this picture, but not in protein losing enteropathy. A patient presents with an ovarian mass that is multiloculated and has a serum CA 125 levels more than 1000. What is the most likely diagnosis? It is serous cyst adenocarcinoma.